It's really wonderful to be here on this snowy evening. The topic of my talk is how COVID-19 has impacted our mental health. Well, it's been a year or more of experiencing so much uncertainty, and it continues with looming shortages of resources for testing, vaccinations, and treatment, concerns about protecting our first responders and healthcare providers from infection, discourse about government imposing largely unfamiliar public health measures, and large and evolving financial losses for many, conflicting messages from our authorities. These are just some of the many major stresses associated with the COVID-19 pandemic that are contributing to global and widespread emotional distress with definite impact on our mental health. Just to ensure we're on the same page, when we talk about mental health, we're referring to a state of well-being in which the individual realizes their own abilities, they can cope with normal stresses of life, and their ability to make a contribution to the broader community. Mental illness, on the other hand, is a medically diagnosable illness that results in significant impairment of a person's cognitive or emotional or relational abilities. Mental illnesses arise from biologic, psychological, developmental factors and can be managed using approaches similar to physical disease: prevention, diagnosis, treatment, and recovery work. So we've had public health emergencies in the past, and we've learned that something like COVID-19 that is so huge and is affecting our health, safety, and well-being brings on a real range of emotions and clearly impacts our mental health. Just to list a few, we land up feeling insecure, we feel confused, we feel lonely due to a whole host of factors that have been mentioned: social, economic loss, work and school closures, lack of resources for a planned medical response. There's some recent survey data that's Canadian that shows that 50% of Canadians reported worsening mental health since the pandemic began. And 1 out of 10 Canadians said their mental health had worsened significantly since the start of COVID-19. Substance use is on the increase. What about suicide? Suicide is not inevitable. It's a complex phenomenon with multiple factors that contribute to suicide. It's heterogeneous, and we need conclusive scientific evidence, which we don't have yet. There is a clear link between economic recessions and increased suicide rates, and we know that certain subgroups are at a higher risk for suicide: our Indigenous population, our racialized groups, our individuals who identify as 2S LGBTQ+, individuals with disabilities, individuals with pre-existing mental health concerns are all at a greater risk for suicide during the pandemic. So the negative impact of COVID-19 on our mental health is not surprising, given that previous health and economic crises have had similar effects. During SARS in 2011, the residents in Hong Kong, where there were many severely affected people, reported difficulties in sleep issues, increased rates of smoking and alcohol use, mood difficulties, anxiety symptoms, and post-traumatic stress type symptoms. And there's been extensive research in what we call disaster mental health. And it shows that feeling emotionally distressed is ubiquitous in all populations. And in our current pandemic, the experience of being distressed emotionally will be replicated in people around the world. During disasters, resilience, which we would refer to as the ability to recover from difficulties, to kind of spring back, is seen by most of us who find some new strength or some new opportunity in our situation. We need to ponder the phrase, "we are all in this together." From the United Nations, it was put out, a focus on the global human crisis and a focus on our human rights responses, with the imperative for everyone to have health care, but highlighting that this pandemic differentially affects people in very different ways and to varying degrees, with a need to highlight the most vulnerable, those that are suffering the most. And there are many groups of people. Some of them I'll highlight. Women are up there. Those who have income security and job loss. Those with children at home who are reorganizing their lives, who are working from home while delivering childcare or unable to work because of childcare needs. Those who fear losing family members who belong to a high-risk group. Those who are mourning the loss of a family member, and that mourning may be complicated and incomplete. There's an enormous collective stress for all family members. Our young children, they've lost their usual physical and social connections with friends on the playground. They're having to adapt to a very different daily structure. There are those at risk of domestic violence, and they're very vulnerable. And where economic hardship impacts intimate relationships, where there's less freedom and privacy and a lot more stress. And there are global reports of increased rates of domestic violence during our pandemic, as well as an increase in violence towards children. So when we think about mental health and COVID-19, we need to stare long and hard at the social determinants of health. And they include income, social support, networks, education, employment, our physical space, biology, access to health services, gender, culture, and others. We know that those of us who are racialized are known to suffer more severe health effects with higher death rates in this pandemic. We know our Indigenous community remains at extreme high risk. Our elderly and those in care homes are extremely vulnerable. Those with disabilities, those who are newer to Canada, those who are living in crowded housing. So not only has COVID-19 put these individuals at increased risk of negative health, economic, and social outcomes, but the pandemic has highlighted the pre-existing inequities in access to healthcare, housing, income, and social supports. There are other vulnerable groups. They're essential workers, they're healthcare professionals, they're teachers, they're COVID-19 survivors who've overcome the illness, and they're those who've had pre-existing mental illness prior to the pandemic. It's important to note that most Canadians who are struggling with their mental health during the pandemic are experiencing a very normal stress response to this crisis. When we think of mental health care delivery, somehow in the space of days to weeks back in March, we all had to pivot to provide access to care through telemedicine. And this is a gift that we've been given, a real opportunity to forge ahead with virtual care. We wouldn't have done it so quickly and so naturally, while maintaining the much needed core of our work, which is human connection. And we know that those with pre-existing mental illness are at higher risk. They're at higher risk of actually contracting the illness. They are at higher risk of not engaging in care. They typically have smaller social networks and are often intensely socially isolated. So we need to offer a real range of supports and services to everyone in our society. And we talk about a stepped care model where you provide the most effective and the least intensive service that best meets someone's needs. And then you give more intensive services to those that have failed the response to lower intensity services. So working in a continuum of care. In Canada, we have Wellness Together, a program with a whole buffet of online resources, self-assessment tools, peer work, counseling, and actually in recent times, the Ontario government has implemented internet-based cognitive behavioral therapy, or CBT, that everyone has access to through Mind Beacon. There are also some wonderful initiatives, one that the hospital where I work, CAMH, has been delivering for healthcare workers, where healthcare workers can self-refer in a very discreet and non-stigmatizing way to access immediate support for their mental health. We also have our roadmap to wellness, where there's a funding commitment of the government over the next 10 years of $3.8 billion towards mental health. And we need to continue to expand telemedicine exponentially. We need to continue to provide virtual mental health care beyond this pandemic. Where I work at CAMH, telemedicine has increased exponentially by approximately 750% in the past year. What about the virus itself, the biology of the virus and its effect on mental health? And there's this newly emerging picture of how the virus appears to impact the brain itself. And there are several groups studying this with cohorts of individuals who've recovered from the virus. And people are developing what we call neuropsychiatric symptoms, brain fog, apathy, memory loss that persists for months. And there's much unknown about the syndrome. Just to turn the focus of my talk a little bit to my area of work, I work on campus in the area of post-secondary mental health at U of T. And prior to COVID, we knew that our students commonly experience psychological distress and mental health and substance use concerns. We know that by the age of 21, over 70% of the population of youth have entered college or university. We know that 75% of mental illnesses emerge before the age of 24, where most youth are at school. And we know that Canadian youth between 15 and 24 years of age are more likely to experience a mental health or substance use disorder than any other age group. So you can see there are a number of additional reasons why our students in particular may be at risk now in the context of the pandemic. Our students' natural university experience is very shifted. Often their living context now is displaced. They're either living, some of them on campus in a socially distanced manner with virtual supports predominantly, and they're not able to have those natural opportunities for independence, developing social connections. And then there are those students that have actually come to our university from homes or countries where there may have been stigma around mental health and mental illness, and they've potentially have had to return or they remain here in very isolated fashion, not to mention their learning environment, which is totally, transformed to the online platforms. And we see, there's a real developmental challenge here. They're not able to party. They're not able to engage in social debates in person. They're not able to easily have intimacy, which they need. They're not able to explore as individuals. And to quote my colleague, these seemingly small individual things are collating, and they're snowballing. So in summary, it's clear COVID-19 is having a negative impact on Canadians' mental health, and this impact is likely serious and long-lasting. We're in this for a good while longer, and we need a longer-term system-wide response, which includes a range of resources and supports. We need the involvement of employers and the workplace, and we really do need upstream investments in the social determinants of health. And it's really important that we continue to focus on mental health. There was a recent poll that showed 7 out of 10 Ontarians believe there will be a serious mental health crisis as a result of the pandemic. Yet Canada was already in the midst of a mental health crisis prior to the pandemic. And so the pandemic's magnified and added to this crisis. And it's highlighted how mental health promotion and care are essential for our well-being. So any successful approach to supporting Canadians' mental health has to address this broader context. And we need a long-term, multifaceted solution. As I close, and I think I'm going over time, I ask you all to hold space for the feelings you may have and end with a poem by the late Mary Oliver, a poet who I really love. And you can interpret this poem as you wish, but the poem really stirs up the feelings of loss, the feelings of sorrow that we're all allowed to feel in the face of what we're all going through. Love sorrow. She is yours now, and you must take care of what has been given. Brush her hair, help her into her little coat. Hold her hand, especially when crossing a street. For think, what if you should lose her? Then you would be sorrow yourself. Her drawn face, her sleeplessness would be yours. Take care, touch her forehead, that she feel herself not so utterly alone, and smile, that she does not altogether forget the world before the lesson. Have patience in abundance, and do not ever lie or ever leave her for a moment, which is to say, possibly again abandoned. She is strange, mute, difficult, sometimes unmanageable. But remember, she is a child, and amazing things can happen. And you may see, as the two of you go walking together in the morning light, how little by little she relaxes, she looks about her, she begins to grow. Thank you so much.